A very good morning. This is Dr. Srinivas, Professor and Head, Department of Prosthodontics, Narayana Dental College. Today we have a topic for discussion, that is theories of edentulous impressions. The main objective of this discussion is to discuss about the fundamentals of making completely edentulous impressions for the purpose of constructing mucosal supported or tissue supported artificial dentures. And also this topic is important for theory as well as a practical examination point of view, because the border molding and master impressions we do at the time of practical examination belongs to this topic. So every possibility of having a questionnaire or the discussion at the time of practical examination is possible. So before I start discussing about the different theories, let me give a simple definition of theory. Theories are system of ideas. They are made or intended to explain some procedures or something, especially based on the general principles. And these general principles are strongly supported by the theoretical knowledge as well as the clinical significance level. So that's why, though these theories are made or proposed around 60 or 80 years back, still these theories are popular in the field of complete denture construction, especially the impression procedures. Whenever we think about the construction of complete denture, we need to correlate that into a civil engineering construction. If a site is given to an engineer, the initial evaluation will be carried out in so many ways. The evaluation of the soil, the boundaries of that particular site, the hard or strength properties of that particular soil will be evaluated. Accordingly, the planning of the construction is carried out and the construction will be executed according to the plan. In the same way, whenever we think about the complete denture construction, we need to have a thorough knowledge about the foundation structures. That includes the supporting structures, limiting structures, and relieving structures. The microanatomy and macroanatomy of these completely edentulous maxillary and mandibular jaws need to be evaluated properly. Any deviation apart from the basic normality need to be identified. Any inflammatory or pathological situations need to be noticed, and accordingly the surgical intervention or the pharmacological intervention need to be implemented before we start making the first attempt of impression. So literature clearly says the tissue must be in healthy condition before we start making the preliminary impressions, because the healthy basal tissues gives a stable denture basis, and the stable denture bases are very important to perform the further clinical procedures like a jaw relation or the wax trial procedures or other aspects. Apart from these normal structures, few aspects of unfavorable situations need to be noticed, if at all, if the clinical situation is not favorable. That includes atrophic mandible or the highly dissolved mandible or the flabby tissue in the maxillary premaxillary area or the bulbous ridges at the posterior part of the maxillary area. So these unfavorable situations requires alterations of the impression techniques or the concepts according to the situation. So to consolidate the discussion of these slides, the famous quote given by Professor M.M. Dewan is, the ideal impression must be in the mind of dentist before it is in hand. We must literally make the impressions rather than take it. So this statement is very valuable, and this statement has never been challenged or disapproved by any of the philosophers till now. The next coming slides will be discussing about the micro and macro structures of the supporting or the basal tissues. And regarding that, the another statement given by Professor M. Dewan is it is more important to preserve what already exists than to replace what is missing. It carries a lot of meaning. Improperly made impressions definitely troubles the foundation tissues, and they deteriorate the basic structures. So the future prognosis of the complete dentures will be in questionable state. So regarding that, we need to know about the structures of the mucous membrane of the oral cavity. Mucous membrane, which covers a bone in the oral cavity of edentulous maxillomandibular ridges, and which acts as a cushion between the denture base and the alveolar bone. It consists of three important components, that is mucosa, submucosa and periosteum. Mucosa, generally it will have a stratified squamous epithelium, but it varies from location to location. Suppose if it is mucosa is at the location of the masticatory masticatory mucosa location, then it will be more keratinized. Then submucosa consists of muscle cells which transmits the blood and nerves and supply to the mucosa. So any changes happens because of improper impression techniques. It affects badly in the submucosa region and alveolar bone region. Then beneath the submucosa, we'll be having the periosteum, the most important structure, which gives blood or vascular supply to the underlying bone from the periphery, from the outer surface. And from the inner side, the spongy bone will have a blood circulation. The next slide will be on the distribution and location of the mucosa. Mucosa here in the oral cavity has been categorized as a masticatory, lining and specialized mucosa. Masticatory mucosa consists of 25% totally, which is firmly adherent, and they are keratinized and they subjected to changes in thickness. Most of the masticatory mucosa is located at the supporting structures of the edentulous jaw. Then lining mucosa will be around 60%. Mostly they are non-keratinized, located at the labial and buccal mucosa for the maxilla, and labial, buccal and lingual mucosa for the mandibular edentulous arch, followed by the specialized mucosa with of 15% of coverage, especially found on the dorsum of the tongues and the lip structures. In coming to the macrostructures of the denture bearing the foundation denture foundation structures, they are categorized as the supporting structures, limiting structures and relieving structures. The supporting structures includes, for the maxilla, the horizontal plates of palatine process of the maxilla are the primary supporting structures. Then secondary supporting structures are the slopes of the palatine process of the maxilla. The limiting structures includes for maxilla, labial vestibule, buccal vestibule, and posterior to the posterior palatal seal are considered to be the limiting structures. Then relieving structures are incisive papilla and mid palatine raphe. If at all, if that particular case consists of the flabby tissue, that also considered as a relieving structures and need to be given special attention to record that structures. When it comes to the mandibular, the supporting structures are the buccal shelf area and posterior part of the residual alveolar ridge. Limiting structures includes the labial vestibule, buccal vestibule and lingual vestibule. The relieving structures includes the sharp or the crest of the alveolar ridge. If the resorption pattern is more, the mental foramina is also considered as a relieving structures. So these supporting, limiting and relieving structures need to be addressed and noted properly for implementing the different particular concept of the impression technique. Now coming to the main categorization of this theories of impression making, they have classified according to tissue displaceability. According to the tissue displaceability, mucostatic impression technique and mucocompressive selective pressure impression techniques. And according to the tray type, stock tray and custom tray, depending on the purpose of impression, we can categorize that into diagnostic impressions, primary and secondary impressions. Depending on the materials used, we can categorize as elastic or non-elastic impression materials. Elastics includes alginate and elastomeric impression material. Non-elastic impression material includes impression compound and zinc oxide diol impression paste. And depending on the technique, we categorize this as open mouth technique and closed mouth technique. So till now we have discussed the basics of the theories of impression making. So the whatever classification I have quoted here, these different types of classifications can be implemented with the different combinations for the particular given case. So next session we will be discussing about the main important aspect, that is mucostatic, mucocompressive and selective pressure impression techniques. Thank you very much.